An FDA committee is recommending the Pfizer vaccine for kids between 5 and 11 years old. Good afternoon. Welcome to The Four. I'm Carlo Cicchetto.
I'm Marcella Lee, in today for Heather Myers. The vote came this afternoon after hours of presentations and discussion. It is now possible children in this age group could begin getting the Pfizer vaccine in just a couple of weeks.
News 8's Kelly Hessedal is live at Rady Children's Hospital with the very latest on this big development. Kelly.
Yeah, Marcelo and Carlo, that vote came down about 1 o'clock this afternoon, and an FDA panel overwhelmingly voted yes and said that the Pfizer vaccine is safe for kids ages 5 to 11. Take a listen.
So we can now broadcast the results, and I will read the votes aloud for the record. Dr. Moore voted yes. Dr. Wharton voted yes. Dr. Perlman voted yes. Dr. Sawyer voted yes. Dr. Nelson voted
And so the list of names went on and on. 17 voted yes, 1 abstained. There were no votes. The vote came after several hours of presentations, discussions. There was a public comment portion. The committee looked at the data, reviewed the science. They discussed things like side effects. They talked about myocarditis, a rare side effect in young men, typically in their late teens or early 20s. Some doctors felt that there needed to be more studies on it. They talked about how COVID cases in children are often underreported, so the actual number of kids who may have already had COVID may be a lot higher than what the data suggests. One doctor argued there may only be a small percentage of the population in this age group who truly benefits from being vaccinated. But another countered with the fact that there have been more than 700 kids under the age of 18 who have died of COVID-19. The bottom line, the question the committee had before them was this: based on the scientific evidence available, do the benefits of the Pfizer COVID-19 vaccine outweigh the risks for use in children ages 5 to 11? And in the end, nearly all of the committee members voted yes. So what happens now? Well, the committee's recommendation goes to the full FDA for approval, which is likely to happen. From there, the CDC takes on the matter, and it's possible as early as the end of next week, children could begin getting the Pfizer COVID-19 shot. Marcella and Carlo?
Kelly, did the panel seem to struggle with the vote, or did it seem like they had their mind made up before the discussions even began?
Well, I think a lot of them had already looked at the data and were leaning probably in the direction of saying yes, but it was something that some of them definitely struggled with. Some had issues with administering or allowing this to go forward for emergency authorization use, would get the ball rolling on mandates in some schools, and some didn't want that. They had an issue with that. On the other hand, though, voting no, of course, would take away the option of getting kids in that age group vaccinated from the parents who want to get their kids vaccinated. So there was a lot of discussion back and forth. Some of the members said that they had received thousands of emails from people on both sides of this issue. So they said this was a vote that they certainly took seriously.
We know there are going to be some people happy with this, other people even more stressed out. Kelly Hessedal reporting live on this big development. Thanks, Kelly.